Hi, I'm Dr. Tom Tozer with Imperium Chiropractic, here with our local Scheels expert, Sarah, and today we're going to talk about a condition that affects a lot of people getting active in this time of the year, in the spring of the year, as they're increasing their activity and running, and that's a thing called shin splints. So we're going to talk a little bit about this condition. What we find, shin splints is an irritation to the tissue on the front of the shin. It can be either the outer side or the inner side. The one we're going to talk about today is called anterior shin splints, and so it's an overuse condition when we start to increase activity, maybe from things like improper functioning foot or ankle. It can be from poor equipment, and Sarah's going to touch base on that. But it's something that affects a lot of people, so we just wanted to make sure that we talk about that. The treatment for that can vary. So one thing that we want to do is we want to make sure that you get some rest. If you're starting to have pain, take some time off and start gradually back to your activity. The other thing we can do is icing of that area, and we'd want to ice about 20 to 30 minutes at a time, and you can do that multiple times throughout the day. We're going to show how we can use one of the products that Sarah's going to talk about, and that's KT tape. That can also assist with that, and then again adjustments to help improve function of the foot and ankle. So we'll have Sarah describe some of the products that they use here in the store.
Yeah, the biggest thing we notice with people that have shin splints is their shoes are old. Sometimes I'll have customers come in, their shoes are 2 or 3 years old and they're still running on them. The cushion from that shoe has broken down so much, the support is broken down, it's not as responsive. So anytime you get a new shoe, that can usually fix the matter. Other things that we use, though, we have KT tape, and they come in pre-cut strips. So you're not worried about measuring how long it is or anything. You just cut it, tape around the area. And we have these in different widths and a variety of colors, too, so if you want to jazz it up, you can. Another thing we like to use, though, we have compression sleeves, which kind of mimics KT tape in that it's just bringing more compression to that area, just closing it up, and you can use that either during or after your workouts.
Absolutely. So we'll talk a little bit about the KT tape as we start to apply it. So the KT tape is going to assist the muscle, and it's also going to improve blood flow. It's going to improve lymphatic flow. So that's the idea behind this KT tape. And again, as Sarah mentioned, they come in pre-cut lengths. In this situation, I actually had just cut down the length of that, and you can see where I left a little bit uncut. So as we apply this KT tape, first of all, we want to make sure we have a nice dry surface, and it's nice if we don't have a lot of hair in the way, so the men may even have to shave their legs to be able to make this work properly. Typically, shin splint pain is going to be on the front of the shin here. So what we're going to do with the KT tape is we're actually going to be surrounding that area to, again, help support that area. We'll start with the KT tape lower on the shin. The anchor does not get stretch on it. And so as we come up the shin, what we're going to do is we're going to put about 50% stretch on this tape. So we're going to come around the area of discomfort and come up, and then the last part of it we just lay down again. So the anchor does not have stress on it. The second strip here, we're going to come more right up the shin. Again, about 50% stretch, and then we'll just lay out that tail. This is heat activated, so you can rub that. You can actually use the paper to help do that. We have a second piece of tape that we're going to utilize. Again, same cutting of that. We're going to start out here on the outer calf at the level of her discomfort. Again, no stretch on the anchor. This one does get more stretch, so as we take a look, we're going to put about 80% stretch on here, coming across the area of pain. Again, the tail does not get stretched. So here we are again, go around that area of pain. When you get across the shin, then we can just bring that tail up, and again, no stretch. So that's the taping of the Kinesio tape. Again, combination of proper equipment, assistance like these sleeves or this tape, and again, we can help improve function with the foot and ankle through chiropractic. And so Sarah here and I would like to just say stay healthy and stay active.